All right, so the next section here for our orthopedic checklist competency, I'm going to be talking about how to get out of bed. And for the most part, it's pretty universal. There are a couple exceptions though, and that comes with back surgeries as well as the anterior and the posterior hip precautions. You have to do things a little bit differently, but for the most part, you can do everything pretty much the same. There's multiple different ways you can actually do it. I'm going to kind of teach you the way that I find is the easiest, and you can, as you experience it and practice it, you can kind of adapt to your own liking. But basically, what you want to do, the first thing you want to do is you want to try to get the patient's body as close as you can to the side of the bed. So let's say Melinda here, let's say she had a right hip replacement, posterior approach. All right, so what you can do, since it's a posterior approach, you can do the bridging. So again, what bridging is it's when you bend your knees and try to lift your bottom up off the bed. Most of the time, a patient's not able to do that because of pain and weakness after a surgery. So what you can do, and really, you probably should have two people for this because you're pretty much moving their whole body weight over. But what you want to do is you want to take one of your arms and support the surgical leg so it doesn't get torqued and cause more pain than should. And then what you want to do is you want to grab the chuck pad here. And then what you can do is you can just kind of bring them all the way to the side, okay? Now, one thing I want to point out, you can do the bridging with the posterior approach. However, you can't bridge with the anterior approach. So with the anterior approach, you're going to want to scoot them yourself almost every time because they're not allowed to bridge. Once they're to this point, what you can do is you can have them move their legs to the side of the bed. So you want you want the patient to get their feet off of the bed. Once their feet are off of the bed, you can go to the next step. But I'll go ahead and help Melinda do that. So one foot, and then the other, okay? All right, and then what we do from here, sometimes a patient needs help to actually sit up. What I've found is very beneficial, you can get a lot of leverage this way, is use the chuck pad again. So if they don't have any shoulder issues or arm issues, you can actually grab onto their hand like this. And then from here, you can grab onto the chuck pad with the other hand. And then I usually count to 3. That way the patient and the therapist or whoever's assisting the patient is going on the same count. And what you do, you go 1, 2, 3, and on 3, you just pull the patient up to sitting. You want to try to encourage them to use their abdominal muscles as much as they can so they can help you out. All right, so I'll go ahead and demonstrate that now. On a count of 3 here, Melinda, we're going to sit at the side of the bed. Okay?
All right.
1, 2, 3. Just like that.